One of the things that I want to talk about and just let consumers know in this episode is that, their health insurance company doesn't have their best interest in mind. So when they send somebody to a preferred provider, it's not necessarily the best, it's not necessarily the cheapest, and it's not necessarily the best service or the best quality. Just because, in fact, I would argue that sometimes what these networks create is they create a little bit of a monopoly. And the insurance companies have this monopoly, and you can't go and pick a doctor that you want to outside of your network. And if you do, you get stung big time.
What people need to understand with PPOs is the majority of them are employer funded. So if you have insurance through your employer, 99% of the time it will be a PPO. Insurances love employer-funded PPOs because the majority of the money getting paid out to providers in a PPO network is not Aetna's or Cigna's money. It's the employer's money. Mm-hmm. So there is no incentive on the insurance company's end to make sure that there's cost savings. Mm-hmm. And so what has happened is you have this enormous PPO network. Basically, anybody can get in, right? There's, if you can pass the basic credentialing checklist that we talked about earlier, you can be a PPO provider. There's no, conversations of show us how you have cost savings for your patients. Show us your outcomes. That doesn't happen to get into a PPO network. It's simply, did you go to medical school? Have you, followed the rules? Have you not gone to jail, et cetera, et cetera? Right, okay, right. You're in the PPO network.